So what happened? How did you start the back pain? I know knee you had an accident. Tell me about it.
It was something that I had learned about over the years. I knew that I had a scoliosis, and I think that was what was triggering everything else.
Right.
All the other lower back pain.
So, and the knee, of course, you were playing with the scooter.
Yes. Yes, that was a self-inflicted accident. I thought that I was professional enough to drive one, but I drove it right into a raccoon, which caused me to wreck it, and it landed on my leg, which is how I had the fracture under the knee.
On the fibula, yes, you had the below the knee on the right side, right knee, right?
Right.
So now I do remember you saying that they put in a cast, they did everything what they were supposed to, but it never healed and continued to cause pain. Isn't that true?
Yes. I went for the follow-up x-ray 3 months later, and it looked like the same x-ray from when I went in.
Yeah, so it never healed. And that's when you came to me initially, I remember.
Yes.
And then you also start complaining of low back pain.
Right.
And about 3 months ago, we did the stem cell treatment on you. And if I remember correctly, the stem cell that we did on you, we took out from the bone marrow and the fat, a little bit fat. You wanted me to remove more fat, but there was not much. You don't have much fat. So we did a little bit of bone marrow, a little bit of fat, very little bit, just need 1 teaspoon. And I think we also did PRP, platelet-rich plasma treatment. We took out from your blood and we mix it together, right? And we injected in your back and knee, on the right knee, correct? So how was that whole procedure for you? How did you feel?
It was simple. It was in and out. And to me, what I really enjoyed about it is it was things from my body straight into my body. So it felt like my blood or fat was getting shipped out to a lab.
Yes. That's a very good point, because a lot of people, sometimes they will, because if it was done in the same room, right in front of you, all your tissues injected into your body, we don't store, we don't ship it out, we don't add anything in it. So that's why this is important. A lot of people are doing treatments and they worry about they're going outside in the Europe or someplace because they take the stem cells out. First of all, I think not many people do stem cells from bone marrow and fat along with PRP. They have advantages. Each one has different role to play and it works better. But a lot of times, like I said, I was saying, people go outside or even in this country they add steroids or they add growth hormone or they add some other stuff. We don't do that. Some doctors, they ship stuff out and they try to grow in a culture and then inject. We don't do that. So we're doing the same procedure, same setting, no storage at all, as well as don't ship it out. So I think those things are, you're absolutely right. You're certain that those things are being, what we're injecting in your body is your own stuff. Now, I remember you were very careful and cautious, and you came, normal people come to me one time and they understand that, but you came to me several times and you really wanted to read a lot of stuff. So tell me about that. You were really careful about that when we started the treatment, before we did the treatment.
It was, nothing on your behalf. It was just being scorned from all the other orthopedics that had said, invasive surgery is the only solution. So it was, okay, well, what am I getting into? I've not heard of this. But obviously it's been around for many, many years.
Right.
So I just wanted to make sure it was something I was comfortable with, and I wanted to understand what was happening, not so much a fear factor. And I'm a very inquisitive person anyway, so I always just like to learn about what's happening.
And which is a good thing, because now you know, before going into the procedure, I mean, it's been around, but at the same time, not many people are doing it, and you didn't hear much, so you want to make sure the doctor is okay, he knows what he's doing. And they're injecting exactly, and those were your main questions. Are you going to inject the same thing? I'm not going to grow a finger out of my knee or something, I remember that.
Yes, that's what I said.
Right. So that didn't happen, right?
No, I didn't have any fingers.
I remember when we saw you on the follow-up, you had tremendous improvement in your back pain and knee pain. Tell me more about that.
I was really expecting a time period of 3 months before I felt anything or for a healing process.
Right.
And it was probably within the second week I had regained all my movement back in my knee.
That's wonderful.
I was amazed. And then my back pain subsided within that same time frame.
That's good.